Okay. Yamangdu Marang, good morning. I'd like to acknowledge the traditional owners and custodians of this land upon which I stand, and also pay respect to the elders past and present. And I'd like to thank Albie Ryan, who's a Wiradjuri elder and one of our Aboriginal hospital liaison officers, for entrusting me with a couple of words which I think fittingly I can start and finish my talk with. So I'm sure I just didn't do that justice, but I'm going to try. So he's a good teacher. So I'm here to talk about the Central West Aboriginal Cancer Network, and sort of had visions of creating this national network, which I think Gail's already jumped me on that, but that's great news to know. And it's really about a combination of all of these groups at the top there. So what I often found was that we're all here and wanting to do the same thing, but we all seem to be duplicating the same work. So we thought, why don't we sit down together as a group and do it all together, and that way sort of pool everything. So I'm going to talk to you about how this happened, and it's really about building partnerships to close the gap. So I'm going to start talking about that. So where did it all begin? Well, last year, it's just about 12 months ago, June last year, we had a cancer and palliative care yarn up, and Catherine, she might be next door, after seeing her talk, it was really came about with the, after they came up, Pepper was there, Cancer Council, AHMRC, and one of the outcomes, and it was really about yarning about cancer in our community and the barriers and all those sorts of things. And really, you know, there were all these solutions that came out of it, and sort of saying, well, you know, this is what we should do about treatment, this is what we should do about screening, this is what we should do about diagnosis. But really the one thing that stood out was that we just need one committee to actually drive all of these strategies. And lucky for me, that action was put on to me. So it was up to me to establish a group, and it was really to get all those local service providers in the same room, at the same table, and look, try and increase awareness and try and develop solutions together as a team. You might say, why is that important in New South Wales? So remember, I come from the central west of New South Wales, so I'm just going to indicate why that is important. And these values, or these statistics, are from 1999 to 2007 from the Cancer Institute. So it's important in New South Wales because all cancer incidence for Aboriginal people was 7% higher than the general population. Now that's not a big difference, but it is still significant, statistically significant. But the other one there is a really important one, is that all cancer mortality is around 70% higher. And look, the big difference between, look at mortality being 70% higher and incidence only 7, that really indicates that there's a significantly lower survival in Aboriginal people when they're actually diagnosed with cancer. So that at a state level is why it's important. Click. See, that worked that time. And then you might say, well, why is it important in the central west of New South Wales? Well, our population there, 9.4% identify as Aboriginal or Torres Strait Islander, and that's versus an average of only 2.5% in the state. So there's a high proportion of our population actually identifying as that. So that's important. The other big thing is that the Wiradjuri Nation is geographically the largest Aboriginal nation in New South Wales, and that encompasses a lot of where we live. And I thank Kathy Robbins, our other Aboriginal hospital liaison officer. She provided me with the tribes map there, and she wanted me to make sure that I use that map because she wanted it to be right, because she said it's very important for these boundaries to be right because people, where they come from is really important. So thanks, Kathy. Click. Then down at the district level, so I don't know if every state's the same as us, but we are broken into districts. I work for New South Wales Health. So our district's called the Western New South Wales Local Health District. So why is it important to them? Well, it's actually part of our Strategic Health Services Plan. And it only has 5 priorities, and the third one is actually to close the Aboriginal health gap. And that priority is about getting the New South Wales Aboriginal Health Plan and sort of making local action happen. And a lot of it, and I heard Gail speak about this, I think it's the goal that we all want. They really want to collaborate with Aboriginal community-controlled health services to achieve a shared, coordinated and joined up approach. And that is the core of our network. That's really what we're trying to do. So, click, please. So how did it start? So we had, and I must pass on, like we started our second linear accelerator at Orange in March last year. So I got really busy around June with the patient building up. And James Daly, our palliative care CNC, he really started saying, come on, we've got to do this, we've got to do this. So we had a meeting in, I think it was August, with the AMS and some local sort of health service providers in the district. And he sort of said, come on, we've got to follow up on our yarn up. And by December, I'd sort of thought, well, it's sort of like conferences you go to, you get really empowered, and then you go home and 2 weeks later it sort of fades away and nothing happens. And I thought it's time to walk the walk and not talk the talk. So in December I said, yep, I'm on board, I've got to get this going, it's my action, I have to take responsibility for it. So we started established meetings, and they were really about making it real, like having a terms of reference, having an agenda and having a purpose, not just sitting around a table and talking. It's sort of, I think there's been enough talk by the sound of it. Click. Part of that talking was, what are the partners that are going to be part of this group? And what I guess people might get out of this today is, if you want to set up your own group, if you haven't got one, is to maybe use our structure rather than go through the pain of where do you start again. So I'll just talk about that. So the partners we have is someone from radiation oncology, someone from medical oncology, someone with palliative care, our Aboriginal health liaison officers, and administration. So they're all people from Western New South Wales District. I'm the representative from RadOnc, so I'm the chief radiation therapist. We actually have an oncologist from MedOnc. We have a PowerCare CNC. We luckily have Kathy and Albie, our hospital liaison officers. And administration. Our administration is really important. Apart from I hate taking minutes, and Joel's very good at it. But they are your face at the front door when the person walks in. And the other thing which Raj mentioned about is collecting data. They're the guys that will really hopefully pick up and identify patients that, you know, we want to capture the data so we can do something about it. So administration isn't just there to take minutes. A lot of the strategy is about, well, how do they pick up the people coming through? And we even just spoke then at tea, do it in a friendly way so people don't feel sort of that they can't identify as Aboriginal or Torres Strait Islander. Click. Now, there's also partners outside, and I guess that's why our group's unique. It's not just people within our health district. We also partner up with people outside of it. And the Orange Aboriginal Medical Service, now we thought it was really important that they actually chair the group and that they drive it. I think you really need a local Aboriginal health service to drive this, because hopefully they have the trust and the backing of the community. New South Wales Cancer Council on our group, the Community Programs Coordinator. Fiona's really resourceful, really enthusiastic. She's been fantastic, so we were lucky to get with that. Click. Click. Yeah, sorry, just one. Other partners we have is the Western New South Wales Medicare Local, the ALO and the Chronic Disease Care Coordinator. They come to our meetings as well. They have a really good base of patient knowledge and also patients that we want to probably contact and get awareness up with, so they've been a great resource. And our friends here, Cancer Australia, I've put them up there as really a resource role. So Isabella, they dial in twice a year now and really provide us with ideas around what resources and grants are available to suit the projects that we're doing at that time. So thanks to Cancer Australia as well, they've been great. Click, please. But in the community, these are probably the most important ones, and because we only just started in January, we were pretty early days, we're looking for an Aboriginal cancer survivor. We did have a man put his hand up. He was really enthusiastic and sadly passed away. However, they're really important because they'll provide insight into the patient journey, give us good suggestions, but also role models. And I'm not sure if I got it from Shahuli's, or we talk about survivor stars down the track. We want to have people standing up as survivor stars to show that cancer just doesn't equal death. You can actually survive this thing. Cancer carers, now this is hugely important as well. We want a cancer carer because we want to know about the role of the family in the journey. And we also know just generally for cancer patients that carers pretty unsung heroes most of the time and lack a lot of support. So we want to know what we can do for them. So these two people, when we do source them, are going to be invaluable to drive the strategies because they have the answers, I don't. They need to say, this is what we think will help, and we need to be able to facilitate that or put the resources in. Click, please. So what are the objectives of the group? This is again going back to structure. So this is, we actually created the terms of reference. So we didn't just want a group that was just a meet up, have a cup of tea. There is a real terms of reference, and our objectives are, and this is a brief summary, we want to identify the needs of people affected by cancer or at risk of getting cancer. We want to increase screening rates, we want to increase treatment support. And the other thing, which I don't know, this conference mightn't be the main place to talk about, but clinical trials. We've got funding for 12 months for a clinical trials coordinator. The MedOncs are really passionate about clinical trials, and we know if people participate in clinical trials, it actually generally helps their outcome. So we want Indigenous people into clinical trials as well. Obviously, you want to develop a lot of collaborative programs, solutions, advocacy campaigns. And we don't want to just do the local campaigns. We want to support at a state level, the Cancer Council, and federal level like Cancer Strait, all those advocacy campaigns. And finally, we also want to improve end-of-life experience for patients and carers. We have some pretty passionate people like James Daly, really passionate about palliative care. Click. So what's on our agenda? It's really simple, to be honest. And this is really just, in a way, the patient journey broken down into stages. We wanted to keep it basic to drive it, because when you sit here today and hear, the bigger picture nearly becomes overbearing and you sort of get lost as to where to start. So we sort of broke up the journey into prevention, screening, treatment, survivorship. And I think survivorship's a big one, because a lot of Aboriginal cancer is nobody talks a lot about surviving. It's about how do we stop people dying. Well, survivorship, really excited about some ideas we have around that, and palliative care. So I think if you're doing a team like this, keep your agenda very simple to keep you on track and so that you don't lose focus. Click, please. We also have KPIs. So it's sounding very official, but I think we need to be to like make this. We were talking yesterday, you know, posed to Raj, I hope I am doing this same speech in 15 years, because it'll mean the group's still going. So it's very hard to keep groups like this going. But if you have KPIs, it will sort of drive the team and it'll measure success, because you want to make sure you're actually making a difference. So our KPIs, you can see there, proportion of people accessing screening, proportion of people accessing treatment and palliative care. Again, going back to clinical trials, we'd like to see more Aboriginal patients in clinical trials. And the other thing we have, which is probably a big ask, is to actually do 2 projects a year. Now, the reason why we've put that in is because we don't want to just sit around and talk again. We actually want to be doing some actions. So it's going to be a big thing, but if I will look like we're on path this year to actually do projects a year. Doesn't sound like a lot, but it is if you're doing it on top of other work. And of course, at the end, we want to make sure that we're, you know, improving the satisfaction of our target group, which is Aboriginal cancer patients. So, you know, hopefully we'll do a satisfaction survey at the end of the year as well. Click, please. So what have we achieved so far? Well, we only started in January, and I must say I'm pretty proud of how far we've come in a short amount of time. We started at prevention and went, let's start at the top of the agenda. And we actually brought all our resources in. Cancer Council did, Medicare Local, the district did. And we actually found there was an information gap, and someone would probably say, oh, we've got some, which is great. There's an information gap. You know, a lot of the information's been adapted culturally, but we couldn't find any really about preventative information or reducing risk. So we're working now with the New South Wales Cancer Council head office to create an Aboriginal reduce your risk of cancer fact sheet. And I think why that probably wasn't there is because historically we've always looked at this doom and gloom of people not surviving it. So they've sort of not really focused on, well, why don't we just prevent it at the start? They've sort of looked at the end result rather than let's look at prevention. The other thing we're doing is a Well Women's Workshop during NAIDOC Week in July, and that's really to increase breast cancer awareness and screening, which I think you guys all know about. But for us, why is that really important? Because in New South Wales, there's similar incident rates, but the mortality is significantly higher, like about 50%. So that's a really important workshop for us out there in the Central West. Other things we've done, I presented at our radiotherapy and service program within my department and at the facility level with the Orange Health Service, and that's promote awareness of our group. And also I'm presenting here today, so on a national level. And it's really, that helps you in the long run to get resources, maybe get funding, or get volunteers, like people will come along and say, you know what, I reckon I can help out and do something for your group. Click. So what are we going to do for the rest of 2014? Moving into that treatment part of the agenda, we're looking to develop an Aboriginal Cancer Carers Pack. There is already a New South Wales Cancer Council Carers Pack, but we're sort of, when we're talking with Albie and Kathy, I guess, you know, we really realise how important those carers are in the Aboriginal cancer journey. And just, we think it'd be great to adapt that pack and just be able to sit with the carers and sort of talk to them about their journey and how we can help them. But where that's leading, and I think this is a big one, is that we're going to look at reviewing our consultation process. So, you know, when you're going to the doctor and it takes 5 or 10 minutes, he says all these big words and you walk out and you've got no idea, what really happened. We want to look at how do we incorporate the cultural needs of the patients. And the light bulb went off. We were in the meeting and, a bit of quick. I went into a meeting and we were talking to Kathy and Albie. We had a patient from really far west and, she was marked as urgent. So I said to Kathy, we're going to push her in, we're going to do this and this. And Kathy said, well, she just wants to go home and feel the dirt first. And I was like, what? So our process was urgent, let's get her in. And everyone was trying to make this happen. And Kathy said she just wants to go back and feel the dirt. And that was a real light bulb moment where we went, gee, if we'd have had a consultation where we took our time and actually asked her what her needs are first, we would have known that before we moved all of this stuff into process. And she went home and felt the dirt. And my understanding of that was to make sure the family was okay first. A lot like I think Archie implied yesterday. The other thing, so I'll move on quickly, is we're going to run a lung cancer awareness workshop. Incidence, mortality really high in New South Wales, so it's important. We are running a awareness day. We have NAIDOC week in October because I'll show you here. Usually this time of year it's too cold, so we'd be normally wearing a scarf. I didn't realise there was a New South Wales scarf there. So. Click. Click. Now I just skipped through that, but I haven't got the laser. We know the lung, we know the breast, but I was talking to Albie just before I left. If you look at prostate, and something I found out, 80% high mortality for prostate, that's just not on. We need to do something about that. So Albie, I was saying, we run the breast thing, we might use that as a pilot and we'll run a prostate one. So I think prostate, we're going to do something about that, guys. Click. All right. So what's needed? You probably all know, you're probably part of teams, and my team probably thinks I run them like a footy team, and maybe I want to be a coach of an NRL club, and I'm now coaching the Orange Roosters. My little fella plays under 8, so maybe I'll get that on my system, but if we click through quickly. Now, the common goal... Can I just say, this is an old photo because we have not won in 8 years. Click, but the common goal there is obviously your team, you've got all wanting to do the same. You all got to be focused, whether it's State of Origin, I don't know what the AFL Cup is called, what's it called? The Holy Grail. You just got to be going in the same direction and keep your eye, like they say in footy, just keep your eye on that final prize. Because if your team's going off in all these bits and pieces, you just won't get there because you just need everyone to work together. And that is coming out of our terms of reference. That's our grand final. That's our goal. So I'll just quickly click. To quickly on out of this, the whole is greater than any individual part. And to bring all these sort of services together, it's easy for one to stand up and go, well, our group needs to do this, but we're not doing that. We all know the whole is greater than one great part. Click. You've got to have achievable KPIs. And the last thing is passion. You didn't see that one. You can see there's one Queenslander standing up in the, if you go back, can we go back on? So just go forward, bum. Just go. And look, the whole thing is, if you're passionate about it, it won't feel like such a burden. The survival rate, it's time we did something. It's time we stood up in the crowd. And if I have to put this on, then in the middle of Queensland in Brisbane, in State of Origin time, we can all do it. Click. And that's only half our team. The other guys are away. And last one, I'm off. Don't worry, references. But the last word I'll finish on is Mungdungu. Thank you.